Is it straight? In 2014, I was diagnosed with breast cancer, and I went through surgery, chemo, and radiation, and I was cancer-free for almost 2 years. And then they found out doing a CT scan that it spread to my bones, and then a couple of weeks later, they found out that I actually had spread up into my brain as well. So I was diagnosed terminally ill.
Medical research right now is really super interesting because we're on the verge of a new technology explosion.
Research in gestational diabetes and women with type 2 diabetes is very important because both of them are increasing markedly in pregnancy, and we need to find ways to help improve the pregnancy outcomes in this very high-risk population.
Research in gestational diabetes, or GDM, gives a window on the mother's future health. And that's very exciting because when you have such a window, then you have the opportunity for early detection of disease and potentially even prevention.
I've been going to the Mount Sinai dental department for almost 20 years. That changed my life.
I think one of the reasons oral health research is so important is that establishment of oral health in and of itself is important. We shouldn't really think of the mouth as being not part of the human body. So if you're not well dentally or orally, you're not well.
Nice, and then looking at me. Thank you. Perfect. And then again. Good. Nice. Looks great.
The research at Mount Sinai, which is on Lamentin, this is the medication he's taking, but I'm hoping it will help further people who get diagnosed with something similar. And the research is very important.
What really excites me is that we're starting to understand the molecular basis of the processes in the brain, which has given us real opportunities now to specifically target specific proteins or other molecules to develop more effective cures. So whilst it's going to be a while before I believe we develop much more effective treatments.
You can see that there's an opportunity there based on the knowledge we've currently gained.
I think it's really important to appreciate that there are 50 autoimmune diseases affecting 2 million Canadians. In fact, the cost of arthritis is something like $17 billion a year. So economic toll and a personal toll.
I've had rheumatoid arthritis for 17 years. And just knowing that people things can be seen more quickly and treatment can happen more quickly. So hopefully the impact of the illness is not quite the same as it has been for me.
The last, say, 20 years, we've seen technology change in ways that nobody could have imagined. Because of that technology, we have incredible opportunities to ask the deepest questions about why people get diseases and to really make a remarkable difference into their personal outcomes.
Okay, 1, 2, 3. Skinner, I love you. I love you in the morning and in the afternoon. I love you in the evening and underneath the moon. Skidamarinky-dinky, skidamarinky-doo. I love you.
Good job. Good. Thank you.
Did it work? That's like a full round of applause there, guys. Research is so important because it's how you save other people. So I'm, working with the Sinai Foundation to raise some money to help save a future me, so someone else can live. That's a pretty cool thing to be able to hopefully give back to someone.